I'm Dr. Asjad Ali. I am a family physician at Reliant Medical Group, and I work at Holden site. Today I'm going to talk about a very interesting topic, and that is men and the doctor's office. Over the years, I have learned that men are not big fans of coming in to see their doctors. It was thought that rectal exam was the reason for men not coming in, but we find that we have to do a lot of encouraging with men of all ages. So today I'm going to talk about a few key areas of men's health and the approach towards screening and care. So on top of the list is, of course, prostate cancer screening. And if you are a young man without any higher risk factors, the good news is that you don't need to come on annual or biannual basis just to have your prostate checked. But for men who are at a high risk, we need to do the prostate cancer screening through a blood test called PSA and a digital rectal exam once a year. And men who are at a high risk are men with a family history of prostate cancer, the African American men, and men over the age of 65. Next on the list is colon cancer. The colon cancer screening is one of the few screening tests that we can do to detect the precancerous lesions, because early detection is the key. And if we can detect something in an early stage, we can remove the precancerous lesion, and that cures the potential cancer. People who have not had colonoscopies in the past, they can be a little bit apprehensive, but I try to do a lot of counseling on the fact that you will be sedated and you are not going to feel anything. So that alleviates a lot of fear of the unknown. Another area of concern with the colonoscopy is the preparation itself, which is the liquid that you drink before you go for the procedure. The approaches have changed now, and now the amount of the prep is smaller and the duration of the prep is smaller too. But I give people some tips as well. For example, you can pour the liquid over ice and then add some ginger ale on top of it. Next, I want to talk about the coronary artery disease. Coronary artery disease is the leading cause of death in men and women in the United States, and it is the most common cause of heart disease too. Coronary artery disease is caused by narrowing of the blood vessels that take blood to your heart muscles. Whenever I sit with my patients, I review the risk factors, and the most common risk factors are family history, high blood pressure, diabetes, bad eating habits, and high cholesterol. So I counsel people a lot on reducing these risk factors. For example, I help them in increasing their exercise, suggestions on how to eat healthy, and then I work with patients to lower down their blood pressure, have a better control of the cholesterol and diabetes too. Last but not the least, I want to talk about sexual dysfunction and low testosterone. It seems as if this is the topic of conversation when I see men in my office. There is a lot of advertisement about the medicine and low T, and there is some misconception that the elevated testosterone level will help with sexual function too, which is not always the case. So the reality is that the testosterone level actually goes down as men grow older. So the normal level of testosterone for a 25-year-old can be higher than the normal level for a 75-year-old man. But if your level is lower than the normal level for your age, we can always use injectable testosterones or topical testosterones. So after today's discussion, my hope is that some men will sit back and think about when they had their last physical with their physician, and hopefully they'll make an appointment today if that's needed. Thank you very much.